A very warm welcome to the new episode of Ink and Insights. This is your host Sumit Sarma Samir. This is a Nepal-based podcast, and if you are interested in listening to the thought leaders from around the world, please subscribe to my channel. I'm extremely pleased to welcome Dr. MariaNeira in my program today. Dr. MariaNeira is a director of public health at the World Health Organization. Dr. Neira holds a degree in medicine and surgery and is specialized in endocrinology and metabolic diseases at the Université René Descartes, Paris. She then obtained a master's degree in public health from the Université Pierre at Marie Curie in Paris, France, as well as a university diploma in human nutrition. She also obtained an international diploma in emergency preparedness and crisis management from the University of Geneva, Switzerland. Dr. Neira, since 2005, Director of the Department of Public Health and Environment at the World Health Organization. Between 2002 and 2005, she was a Vice Minister of Health and Consumer Affairs in Spain and President of the Spanish Food Safety and Nutrition Agency. She has been working for WHO since 1993, with her first assignment being coordinator of the Global Task Force on Cholera Control, and then being appointed in 1999 as Director of the Department of Control, Prevention and Eradication. Dr. Neira has been awarded the Médaille de l'Ordre du Mérite National by the Government of France, the Spanish National Nutrition Strategy Award, the Musée Extraordinaire Award by Queen Letizia of Spain, and she is currently a member of the Royal Academy of Medicine of Asturias. It is such a pleasure to have her in my show. Dr. Neira, thank you so much for your time.
My pleasure. Pleasure is mine. Thank you.
Dr. Neira, let me begin by asking, what has been the most rewarding, part of your role as Director of Public Health and the Environment at WHO, and what keeps you motivated in this challenging field?
I think the most rewarding of this work is to have the capacity to move mountains. Whether it's a small one or a huge mountain, you can always do something for public health if you choose your partner, if you use properly the power of the organization. So for me, there are many rewards, lead from paint, lead from gasoline, removing the treatment of the campaign we are doing now on a big scale on air quality, climate change in the international arena, plenty. I got rewards almost every single day, little, medium, or big. I am committed to public health, so I enjoy every single day.
Wonderful, wonderful. What do you think, by the way, are the prominent global public health issues today?
I think clearly climate change will be put at risk. All we have done in public health, the access to water, access to sanitation, access to safe food, access to clean air, shelter, people living in a place where they can produce agriculturally and having something to eat. Climate change will be very much shake all of those pillars of our health. But if you ask me for two concrete public health issues, one is air pollution, which, by the way, is very much linked to climate change. And the other one, I think, is very much related to our lifestyle, which is obesity and all the diseases that are associated with obesity as well, sedentary lifestyle and others.
Right. And can you please highlight some of the key initiatives that your department is currently working on?
Yeah, as I say, on climate change, we are making sure that people has the scientific evidence needed to demonstrate that climate change is affecting our health, that the climate crisis is a health crisis. So we are mobilizing as well all the political environments, COPs, and negotiating with member states, making sure that they will take action, they will transition in a way from fossil fuels combustion, and reaching as much as possible the governments and giving them some very good interventions that will have an impact on protecting the people's health. On air quality, we have guidelines, we have norms, standards. We are reminding governments that when they go beyond those standards on air quality, the health of their people will be very much at risk. We produce numbers, estimates. We are giving to our policymakers and governments a horrible figure, which is the one that 7 million premature deaths are occurring every year. Every year, 7 million premature deaths due to exposure to air pollution, plus all the chronic diseases that this represents. We work on chemical safety, we work on radiation, we work on water and sanitation and occupational health. So plenty of issues where we can protect people's health and promote interventions to keep them healthy, not just treating them when they are already sick.
And as you have already pointed out, that climate change is not only spoken everywhere today, but is felt everywhere, in fact, very deeply. How can we cope with this challenge?
Well, we need to raise our voices and we need to put pressure on our politicians, on our governments. They are going to COPs every single year and they keep negotiating and negotiating. Everybody's negotiating as if we were gaining something, if we reduce our ambition. And it's the other way around. The more ambitious you are, you are protecting your citizens, not only health, but economy, future, sustainable development, jobs, everything. But I think as humans, we are really behaving on a non-intelligent way now on the way we are dealing with climate change. We are causing it. We are aware of the consequences of climate change, and we are negotiating to say, no, I don't want to do more on this because it will cost me money or something, without realizing that you are destroying the possibility of survival of your own country, city, or locality, and particularly the health of your citizens. So many things to do to protect ourselves, but more than anything, voting the right people, using our influence, and putting pressure on our governments for them to stop using fossil fuels and transition into other sources of energy. And of course, as individuals, there is always things that we can do as well. Recycling, be conscious about energy use, the transport we use. We can use public transport systems or bicycles or walking a little bit more. And individually, we can contribute as well. But there are certain policies that needs to be taken at a very high level, yes.
Yeah, I mean, you have already touched upon this, but I want to bring it back again because this is one of the pressing issues that we in Kathmandu or in Nepal face as well. Poor air quality is a significant public health concern. And this, in fact, is not only limited to, within one nation. So what strategies perhaps the neighboring countries can also take to sort of combat air pollution together?
But the first thing that the country needs to do is to do an assessment from where the sources of pollution are coming. In the case of Nepal, I think we have a very clear idea where those sources of pollution are coming from. Essentially, is the combustion of fossil fuels for transport, for industrial purposes, for cooking. So we need to look at how to replace those fossil fuels and move into renewables, solar panels, subsidies for people to use more electric and less fossil fuels. We need to stimulate the investments in the renewables once again. We need to promote a sustainable transport, a public sustainable transport, instead of stimulating the individual use of vehicles which are polluting in all sense our cities and going into our health and destroying it. So there are many interventions, and of course working at the global level as well to make sure that we reach powerful agreements at the conference of the parties on the reduction of emissions, because as you rightly say, it's not just to the country. You can have transboundary pollution as well. Yeah.
True. Yeah. And the most other important, challenge seem to be coming from the business community as well. I mean, not to paint them negatively, but just to highlight that, the production of the food that are packaged in a certain way that also contribute to sort of the environmental pollution. And then there seems to be a very close nexus between the government and the business, and it's difficult to sort of do away with that kind of challenge.
Yeah, I mean, in the case of tobacco, for instance, we knew that we have a huge enemy in terms of public health. And whatever politic we will be using and policies we will be using to convince people to stop smoking, we will have a big enemy in terms of conflict of interest and commercial interest and money and business. In the case of air pollution and climate change, I'm afraid we have many enemies because it's the fuels companies that are, of course, feeling touch and they are making incredible benefits every year, the equivalent to the country's GDP. But we have as well the food industry, of course, and the way we do transportation and vehicles and all of that. However, the argument could be that if you move to renewables, there is a big business there as well. So we might transform our economy. And of course, nobody wants to go against economic development and generating benefits for our society. We need that economic benefits to advance as a society. But we should not do it by destroying ourselves, by committing suicide. We should do it in a smart way. There is no reason why we cannot have wind energy, solar energy, green jobs, sustainable production of food, a different planning of the urban design of our cities. So, and all of that will generate a good economy as well. It's feasible. If you look at the Scandinavian countries, they are the richest one now. And they are not destroying their environment, and they are still economically very successful. So this argument that we need to destroy the environment and by secondary effect, destroy our lungs, destroy our health, if we want to keep an economy, that's not true. That's not true anymore.
Exactly. Perhaps the kind of shift that the world is taking, it's difficult for the generations of people to sort of adopt to that kind of shift, and it's perhaps taking time because of that. But one of the other important area that at least we have been hearing for the last couple of decades is there's a lot of work that's been done on clean water and sanitation, but still it remains a critical issue in many parts of the world. How is your department addressing these challenges?
And I think this is a shame in all of us. I mean, the fact that the world is still keeping a big percentage of the population without access to clean water, I think is a failure for all of us as a society, that we need to fill that gap. I mean, it's totally unacceptable that a big percentage of our population, they don't have sanitation services, they don't have access to clean water, or they need to rely on girls that are collecting water, spending 3 hours a day to bring water back to home. I think those are human rights, and we should be, as a society, global society, we should be able to fill that gap. Our department is raising awareness every single day. Yesterday, on a high-level panel on political forum in New York, working with other UN agencies, presenting data very regularly, very critical data, demonstrating how, if you don't have access to safe water, the diseases that are associated are there, and you will be unable to reduce maternal mortality, for instance, if you don't increase access to sanitation and safe water. Even at the healthcare facilities, we still have a big proportion of healthcare facilities without soap, without hygiene, without water, without sanitation services. This is ridiculous and really an investment that pays by itself, because it's the most basic human right that we all have, access to food and clean water, at least. Yeah.
And what specific health challenges do urban environments pose? Is that different from the rural kind of lives? That is there a fundamental difference between the urban and rurality of the environment?
Yeah, there are certain conditions at the urban environment that will create a healthy or unhealthy place for your health. At the urban level, you will have, if you have a very dense traffic, of course, you will have more injuries. You
Right.
will be forced to have a sedentary lifestyle because it's difficult to walk in certain cities where there is a very intense traffic and vehicles, and we don't have the possibility to have an active lifestyle, and therefore, a sedentary lifestyle means metabolic syndrome. It means diseases like diabetes or hypertension or diseases that are associated with sedentary lifestyle and obesity. So, in addition to that, if you live in an urban area, the concentration of air pollution will be higher.
Right.
Of course, the air pollution exists in rural areas as well, but the vehicles are more concentrated, so you are more exposed to air pollution. And then noise pollution, of course, and in an isolation. There is a social isolation many times in big cities where you have mental health issues because you don't have the social interaction that is needed because of this traffic or because of the isolation that certain cities are creating. So, and now the heat waves that are affecting many cities and because of climate change,
Right.
at urban area, you might not have trees and very little green areas, and therefore, the building construction might even expose you to areas where you don't have shadow or you don't have a green area where you can rest or being protected for the heat waves.
Right. And how does the public health and the environment department ensure that health interventions are equitable and reach vulnerable populations?
Well, for us, vulnerable population is our focus. We try to protect those more vulnerable, trying to accelerate access to investments on water and sanitation. If somebody's building a hospital, we put some criteria and preconditions for whenever you have a hospital, at least to make sure that they will have access to electricity, to water, to sanitation, to hygiene, basic services. We do vector control to make sure that since we are now the vulnerable populations are now more affected by climate change, we
Right.
need to make sure that those countries are putting in place some climate resilient interventions like vector control or better epidemiological surveillance for climate sensible diseases. So we work with from ministers to private sector, anyone who can have an impact. Our work is providing the scientific evidence, convening the communities, mobilizing the resources, raising awareness, and making sure that we develop the policies that our politicians will not be able to say, oh, I didn't know. No way, no excuses. You have to confront the reality, and if you didn't invest or you didn't make access to safe water or clean fuels for cooking, you cannot say, I didn't know.
Right, right. Maria, I mean, let me share my personal experience. I mean, for the first time in all these years, I felt, I had never felt that much of, heat in place like Kathmandu. The entire South Asia region seems to be feeling that kind of climate change right now, right in front of our doorsteps, and the action seems to be. I think we are not innovating enough to sort of rapidly to take actions to deal with this kind of environment. perhaps there's also a need for certain kind of innovation, Maria, wherein the collaborations has to be there. So, what kind of partnerships are essential for WHO success, and how do you foster these collaborations?
We have a partnership with the civil society, and I'm convinced that civil society, the youth, any journalists, media, Moms for Clean Air, there are many associations with whom we work, and those are the ones that are activists and can change things or given by example. We work as well, of course, with partnership with medical associations, public health schools, all type of networks of health professionals that are very much needed. Pediatricians, for instance, are now a very strong voice on clean air. And of course, from the private sector, with all due boundaries and safeguards that we are creating, we recognize that innovation is part of that, and we are stimulating that innovation. As you know, the health system at large is contributing to 5% of the global carbon emissions. And therefore, we can reduce as well our own emissions. So we are working with pharmaceutical companies to see whether we can reduce at the supply, the packaging, procurement, how we can reduce plastic use, how we can reduce certain packaging that is unnecessary, contributing to the greenhouse gases without giving better care to our patients. So innovation definitely is there, but sometimes innovation is brain innovation, what we need of our politicians and our society, understanding the crisis we are on.
It's just out of curiosity, you were just mentioning about the role of pharmaceuticals companies. How can they contribute to sort of greener and healthier sort of environment?
They obviously, a private sector is a private sector, but they recognize now that they need to contribute to this greening the health sector. They need to contribute to reduce emissions, and they are keen on doing it, whether it's because they have public pressure or whether because they have good managers that understand, whether because at the end of the day it will be a reduction as well in prices and maybe benefits. So they are doing it, and we have a collaboration with them through the network called Sustainable Management Initiative, and we are creating a kind of even healthy competition among them to make sure that if one big company is reducing their contribution, is in competition with another one, we use that to stimulate them to go further. And I have to say that the people we are working with are very much motivated and happy to go back to the COPs and report back and say, we have reduced that much. I suppose it's a good image as well. That's why I was saying before, it's not just a negative or you are the nasty one, so you now need to behave. No, you can even have incentives if you do that. And I think for mayors at the urban area, a mayor who takes interventions or decisions on reducing traffic, on promoting a sustainable public transport system, we can quantify for them the health benefits they will obtain. And that I'm sure that will bring them more votes when they need to be re-elected, for instance. So and the economy will be better as well.
Absolutely. So what do you foresee as the biggest public health and environmental challenge in the next decade?
We have, for instance, one thing we are working on it is the impact of microplastics in our health. We are looking at the issue of electronic waste. We have mountains of electronic waste now going to developing countries where the recycling is not happening. So who is doing the recycling is the very poor people, the very vulnerable people. And to recycle those material that they want to sell, maybe for $2 a day, they spend hours exposed to those heavy metals and then electronic waste is becoming another one. And I don't want to give a long list because it's depressing, but endocrine disrupting chemicals, certain chemicals that we are using on our daily life that are behaving as hormones and therefore changing our system and having an impact on our reproductive life and others. So many issues and environmental health that, of course, climate change is now a kind of overarching and affecting all of them on a critical way.
I feel, Maria, the younger generation are people quite innovative. They are willing to sort of, engage with all sorts of these challenges. And how is the WHO engaging with younger generations to promote public health and environmental sustainability?
Well, on climate change, I'm very happy to say that we have a big engagement and a big partnership with the youth movements. We have several associations, International Medical Students Federation. We have plenty. I don't want to give names because they will feel bad if I don't quote all of them. But we work very much with the youth, and we are very happy to see that they are obviously the strong activists, and their voice can be very strong. But as well, I'm very happy with the collaboration with moms. There is a group called Moms for Clean Air or Warrior Moms, because when the moms, they see that the asthma that their children are suffering is related to the bad quality of the air they breathe every day. Wow, those moms there will fight on a very strong way. So moms and, of course, fathers as well. I'm not saying that fathers are not fighting, but there are... They do, of course. But those movements for me are so powerful because, when you fight for the health of your children, wow, you are unstoppable.
Exactly. Maria, moms have always been our saviors. So, I'm hopeful that they would do their best. So before, I think this will be my last question to you, Maria, what legacy would you like to leave behind when you leave WHO?
Wow, what a question. I want to leave the legacy of passion. Whoever will come after me, they need to maintain and elevate the level of passion to achieve something on environmental health. The area is so big, so huge, that the person needs to have passion. So I'm leaving as a legacy my passion, and I hope others will take it and elevate it even more.
Maria, we wish you all the good luck for whatever you are doing, and thank you so much for your time. It's exceptionally amazing talking with you.
Thank you so much. It has been a pleasure for me as well. Thank you.
Thank you.